thank you, Nyovani, for coming for the interview. We just want you to tell us a bit on how AFIDEP facilitated the drafting of the Malawi commitments for the ICPD25, and especially on having a budget line allocated for reproductive health.
Right. So first of all, what we had to do was to look at the evidence, to look at where Malawi is at in terms of the ICPD indicators. So we looked at how well Malawi is doing on under 5 mortality, maternal mortality, access to contraception and other services, how well it is doing in adolescents, work, and so on. And then based on that, we were able to sort of make initially draft commitments, which we then took to a national symposium to get the people to actually look at what we were suggesting, and then for them to actually critique and interrogate. We thought that we should do it this way because if we just went to a meeting with nothing, it was going to be a long period of time to actually start drafting there. But we looked at the evidence and then made some suggestions to say, on this indicator, Malawi is here. What we are proposing might be a change to 2030 of this magnitude, taking into consideration the progress it had made in the previous period and also the status of the country at the moment. So it's not good suggesting that, okay, we're going to eliminate something where it's going to take 50 years and then you say we're going to eliminate it in 20 years or something like that, or even 10. So that's how we did that. On the issue of budget for reproductive maternal health, we were looking at the commitment that the government is making towards accelerating the promise for ICPD, and noting that in the reproductive health area there are a number of areas where there is lack of progress, particularly to do with insufficient funding. Most of the times with reproductive health, we tend to get other governments actually support our African governments and Malawi in particular to purchase commodities for reproductive, maternal, newborn, adolescent and child health. And when we looked at where the government's expenditure was at relative to the health budget, we thought that it was actually quite low, taking into consideration that matters of reproductive health, child health, maternal health, they actually affect almost everybody in the country. So we made a suggestion that if the expenditure was 8% of the health budget, then we really need to be looking at least 30% and even higher. So our suggestion for 30% was more in looking at where the country is at in terms of the indicators, the progress that it needs to make, and looking at the insufficient budget that was going to reproductive, maternal and newborn health. By saying 8%, I'm not saying that that's the total budget, because there is a separate budget for commodities that's essentially helped by donors. But we were looking at funding from the Malawi government for other aspects of reproductive, maternal, newborn health, etc.
All right. So how did you get the message in? Did they just accept? I mean, you did the homework, yes, but how did you go navigate the negotiation landscape?
Okay. In fact, the money part was actually initially wasn't accepted because they wanted to know more why we had made that suggestion. With the other indicators, there were indicators that were already commitments made by the government, either through the Sustainable Development Goals or through the Maputo Protocol. And the ministry and the government were very clear that if you are actually suggesting, strengthening our commitments to progress in areas we've already made, regional commitments or global commitments, then there is no discussion because that's government is willing to do that anyway. But if we're suggesting things that need discussion, then they needed more information. So we were asked to say, why have you come up with this number, and where are you getting the information from in terms of the expenditure on reproductive health. So part of the team we had members from Health Policy Plus, we had members from other committees and other NGOs that are working in health. And so it was collectively looking at the evidence that was there and then making that decision to say we should be ambitious, and we proposed the 30% from AFIDEP to say that's where we should be going at. And so after just saying to the ministry, and we were quite honest to say we didn't do any calculations to say it needs 30%, but we were saying this is an ambitious target for the country to actually be aspiring towards. So we were very pleasantly surprised when they said that even this commitment is accepted.
Okay. Yeah. So anchoring the issue on existing frameworks and commitments.
Yeah.
And then you talked about the evidence that you were able to project.
Yeah.
What would we achieve in 30 years?
Yeah.
Are there specific tools that AFIDEP has for doing those kind of models and projections?
Yeah. So, we look at trends. So we look at trend analysis. So for example, I'll give you an example of maternal mortality ratio, where the Sustainable Development Goal has a target of a global target of 70 deaths, maternal deaths for every 100,000 live births. That's a global target. On average, by 2030, the world needs to have that as an average. But it doesn't mean that every country needs to be at 70. If every country was at 70 or lower, that would be great. But the reality is some countries are, like Malawi, are at 440 maternal deaths per 100,000 live births. So what we looked at was the trends in maternal mortality in the country, and we looked at the average rate of decline, and we looked at countries that have actually made significant progress and have been considered as making very good fast progress, and looked at the rate of decline there. And we actually then thought, okay, if Malawi could aspire towards that example of other countries that have made significant progress, then we would be in a good place. And using those numbers, we calculated that if Malawi is really intensifying its efforts to reduce maternal mortality in the country, then very good will mean going from 440 to about 110. So still higher than the 70. But we thought it was very unrealistic for the country to claim that they would have lower than 70 deaths per 100,000 live births.